Naturopathy is a drugless system of healing that combines traditional therapies with modern scientific understanding. Hello, I'm Dr. Udayalakshmi, Senior Physician, Department of Yoga and Naturopathy at Swatantra Integrative Neuro Rehab. When we speak about rehabilitation, we must understand that rehabilitation is not only about muscles and movement, it is restoring the entire system: physical, neurological, emotional, and metabolic balance. Naturopathy is a drugless system of healing that combines traditional therapies with modern scientific understanding. The main goal of naturopathy is to stimulate the body's self-healing capacity. Evidences shows that structured multidisciplinary rehabilitation improves patient outcomes when initiated early. Stroke is a neurological emergency that occurs when blood supply to a part of brain is interrupted due to blockage or rupture of blood vessel. Brain cells begin to get damaged within minutes. This can result in weakness or paralysis on one side of the body, difficulty in speaking, swallowing, facial deviation, imbalance, memory problems, and altered consciousness. At Swatantra, these therapies are not used alone. They are integrated with physiotherapy, occupational therapy, speech therapy, psychotherapy, diet therapy, Ayurvedic management, and modern medical management. The program is guided by Dr. Archana Purushottam, our Chief Medical Director, neurologist, and stroke specialist, faculty at Baylor College of Medicine. Acupuncture is an important supportive therapy used in stroke rehabilitation. It helps to manage common post-stroke problems such as paralysis, difficulty in speech, swallowing, respiratory weakness, altered consciousness, cognitive disturbances, pain, etc. So in this therapy, fine needles are inserted at specific points on the body to stimulate sensory and motor nerve pathways, and sometimes low frequency electrical stimulation is added to enhance the effect. It also improves blood circulation, helps to reduce muscle stiffness and spasticity, supports coordination, and enhances neuroplasticity, that is the brain's ability to form new connections, thereby supporting the functional recovery. Yoga therapy plays an important role in rehabilitation. It helps the stroke recovery through breathing practices, breath-assisted body movements, and gentle postures. Alongside, meditation helps to calm the brain activity in stroke patients by slowing down excessive mental activity and promoting relaxation. It reduces stress, balances the autonomic nervous system, and supports emotional stability, which is very important during recovery. A calm brain state also helps to improve attention, awareness, and supports neuroplasticity. Mantra chanting or simple sound practices stimulates the brain through speech and vibration. Repeating sounds activates the areas of brain involved in speech, breathing, and motor control. The vibration produced during humming or chanting gently stimulates the cranial nerves and improves the breath control. This can help patients with speech difficulties by retraining the sound production and improving the voice quality. Aromatherapy uses diluted essential oils that work through smell and skin application. When inhaled, aroma quickly reaches the brain through olfactory pathway and influences the area that controls emotions, memory, and stress. This helps to calm the mind, reduce anxiety, and balance the autonomic nervous system, which is important in stroke recovery. Hydrotherapy. It is an important supportive therapy in naturopathy for stroke recovery. From a naturopathic perspective, water acts as a natural healing agent that stimulates the body's self-repair mechanism. The buoyancy of water reduces the effect of gravity, making movements easier and safer for patients with weakness or paralysis. Hydrotherapy also calms the nervous system, reduces the stress, improves sleep quality, which is very essential for recovery and overall well-being after stroke.